you live with ADHD, you might be familiar with the impulsivity, the distractions, the forgetfulness, but there's something deeper, something many people never talk about. Hi, my name is Brigitte. I'm a nurse practitioner and I have ADHD. Today we're going to be talking about rejection sensitive dysphoria, the hidden pain of ADHD. Rejection sensitive dysphoria isn't the same thing as emotional flooding. I will cover that in another video. Rejection sensitive dysphoria, or RSD, and for many is the most painful part of having ADHD. Now, rejection sensitive dysphoria isn't officially listed in the DSM, but ask anyone with ADHD and they'll tell you it's real. RSD is an intense emotional response to the perception of rejection, criticism, or failure. It doesn't have to be actual rejection. Sometimes just the idea that someone is disappointed in you can trigger it. People with RSD might spiral from a single unanswered text. A mild critique at work can feel like a personal attack. Even imagining someone might be upset can lead to emotional shutdown or explosive reaction. RSD is thought to be linked to the way the ADHD brain processes emotional stimuli, particularly in areas of the brain responsible for regulating mood and threat perception. What would be a small bump in the road for someone else feels like an emotional crash for someone with RSD. Here's what RSD might look like: feeling crushed by even gentle criticism, avoiding opportunities for fear of failure, over-apologizing or people-pleasing, emotional outbursts, or withdrawal after feeling rejected. So what can you do if this sounds like you? First, know that you're not broken. RSD is a common part of ADHD, especially in women and those diagnosed later in life. Here are a few ways to manage RSD. Recognize when it's happening, name the feeling, this feels like RSD. Practice self-compassion, set boundaries, and communicate openly with loved ones. Consider therapy, especially CBT, which is cognitive behavioral therapy, or ADHD-informed counseling. Talk to your provider. In some cases, ADHD medications may help regulate emotional responses. ADHD occurs in a spectrum, right? So there is no shame if you need medication, and this person's ADHD may be very different than this person's ADHD, so keep that in mind. RSD may be invisible to others, but your pain is real. You deserve support, tools, and understanding. You are not too sensitive, you're not overreacting, you're navigating the world with a brain that feels deeply, and that's not a weakness. If this resonated with you, subscribe for more ADHD insights and support from a nurse practitioner who gets it. Stay compassionate, stay informed, and most of all, stay kind to yourself. Make sure you like and subscribe.